I'd like to call the House Health Full Committee to order. Will the members please get logged in, and will the clerk open up the roll? All right, has every member? Nope, not yet. All righty. All right, clerk, can you take the roll?
Mr. Chairman, 19 members present. You have a quorum.
All right, thank you. And before we get started, do any members have any personal orders? I think Chairman Clemens.
Yeah, thank you, Mr. Chairman. Today I am joined by a young man who is shadowing me. His name is Noah McLean from Murfreesboro, Tennessee. He's a senior at MTSU, and he is a reporter for MTSU Sidelines. So let's make Mr. McLean feel welcome.
Chair Lady Hilton Haynes.
Thank you, Mr. Chairman. I would like to welcome Dr. Dave Bhattacharya from Erlanger Children's Hospital in Chattanooga. Let's give him a round of applause, please.
Representative Mitchell.
Yeah, thank you, Mr. Chairman. Hey, I'd like to welcome a fraternity brother of mine, Shane Hooper. He's here hanging out with Pat Marsh today, so that's kind of scaring me.
Okay. Well, thank you for joining us. All right. And joining us today is a Dr. Dale Kreiner. He's a family medicine specialist. He is the TMA's doctor of the day. Is he out there? Can you stand up? There we go. Thank you for joining us. And I would be remiss if I did not look in the camera and say, happy birthday to my wife, Cheryl. So it's her birthday today. All right, and we have a calendar of 16 bills today. So before we get going, item number 6, House Bill 389, 387 has been rolled to first calendar of 2026. Item number 12, House Bill 819 has been taken off notice without objection. All right, that brings us to the start of our calendar. And we have item number 1, House Bill 164 by Speaker Marsh. You are recognized. You have a motion and a second, and I believe you have an amendment that is traveling with the bill, so we don't have to vote on that. So you are recognized.
Thank you, Mr. Chairman. And we do have, I think, some testimony on both sides, if it's okay with you. But the bill we're dealing with today is about animal chiropractors. The purpose of the bill is to establish educational standards which must be met by chiropractic physicians and veterinarians who perform animal chiropractic work. Chiropractors and veterinarians that receive additional training and certification in animal chiropractic care should register with their boards and be able to provide chiropractic care on all animals. Animal chiropractic is defined as the evaluation and treatment of a non-human vertebrae or extremity joint dysfunction through spinal, joint, or musculoskeletal manipulative therapy and soft tissue therapy. An animal chiropractic does not include performing surgery, dispensing or administering of medications, or performing traditional veterinarian care. These animal chiropractic doctors receive a 4-year college education, then they go to chiropractic school for 4 more years, and then if they want to work on animals, they have to do another extensive course of at least 210 hours and then 6 hours annually. We've been doing this practice in the state of Tennessee for over 100 years. We've been certified in the state of Tennessee since 1989. And the problem is that we have recently, veterinarians have tried to stop the chiropractic animal chiropractors from doing work on animals unless they bring it to the veterinarian first. So that's what we're trying to remedy today. And these animals are not humans. And even in humans, we don't have to go to a doctor before we go to a chiropractic doctor. These, what I'm saying today is the owners of these animals should be given a choice. It's their choice. It's their animal. It's not it's their property, and they should be given a choice whether to take it to a vet, which they certainly can, or to a animal chiropractic person. And here's a problem that I see about it is if this bill does not go into effect and the veterinarians have their way with this, you will have to take your horse, cat, or dog to a veterinarian first. And then if they agree, then you can take it to an animal chiropractor. This will be a double charge. The first one you'll be charged by the vet and the second one by the chiropractor. I just think we need to leave this a choice up to our citizens of the state of Tennessee. With that, I'd like to see if we could go out of session and let the veterinarians and the chiropractor folks tell us their side of the story.
Okay. So without objection, we will go out of session. And we have 4 people that are present to testify. We'll have all 4 of you guys, everybody come up. We have an Elizabeth Griffin, an Emily Dryden, a Tiffany Stevens, and a Richard Cole. So if y'all can just, grab a seat there and yeah. And we'll go, I guess, from my left to right, if you can. Tell us who you are, who you're with. We'll give you each 3 minutes, and then at the end, we'll take questions, and they can direct the questions to whoever they wish. So, but we'll start here on the end. If you can tell us your name and who you're with.
Hello, my name is Emily Dryden. I'm a veterinarian in Gallatin, Tennessee at Critter Clinic. I'm representing the Tennessee Veterinary Medical Association.
You can go ahead in 3 minutes.
Thank you all for having me today. I am definitely on board with chiropractic care for animals. I spent 10 years in equine practice. I think chiropractic care for animals is extremely beneficial. However, I think it's important to have the veterinarian involved in the care of the animal prior to seeking chiropractic care, because unfortunately our animal friends can't talk for themselves. They rely on us to help determine what the problem is and that we're seeking an appropriate modality to treat the problem. Many times animals present with back pain that happens to be referred from another area in the body. I saw a dog a few weeks ago who had what appeared to be neck pain to the owner. Turned out that the dog had a very severe ear infection. And so upon a full physical exam that I performed, I was able to determine the dog had an ear infection due to a mass inside of its ear, a tumor in the ear. That led the owner to believe that there was neck pain involved. That's not a condition that chiropractic can treat. And as much as I love chiropractic, it's not always appropriate for every animal. I think it's very important that we keep in mind diagnostics have to be performed for us to evaluate the spine of an animal correctly. It's not just a physical exam. Oftentimes, radiographs are needed for me to determine where there's pain in the spine or if there's a problem in the spine. Sometimes on radiographs, I find other things like a splenic tumor. I don't know that chiropractors are necessarily equipped to discuss or to deal with organ issues that are arising from the abdomen of the animal. And if so, are we going to let chiropractors take those x-rays so that they can evaluate the spine with x-ray capability? Many times I have to sedate an animal in order to obtain orthopedically diagnostic x-rays. So then I've administered a medication, which is prohibited by this bill for a chiropractor to do so. I saw a dog yesterday for a physical exam. He bit my arm. You all can see the bruise. I needed to sedate him in order to perform the physical exam. So are chiropractors going to be able to administer those medications? And again, the bill says no. These things are things we've got to consider when we're talking about treating animals versus people. The dog can't tell me where the pain is. I have to find it out. it's important to do these diagnostics in order to make sure that we're treating the appropriate area. Because again, then it comes back to the situation, Mr. Speaker, where the animal is getting, or the owner is paying 2 or 3 different people, or spending excess money to find the root of the problem. And I'm for folks having a choice. I really am, but they need to see the veterinarian first.
All right, thank you. All right. Just
It's on.
give us your name and who you're with and
Hi, my name is Elizabeth Griffin. I'm a Clarksville-based veterinarian. I'm here representing myself as somebody that's actually gone through animal chiropractor school. I did my certification through the IVCA, the International Veterinary Chiropractic Association. And the way this bill is currently written, I wouldn't be able to offer chiropractic care to my animals. It excludes not just veterinarians, but doctors of chiropractic, which half of my class was. And I've had classmates that have gone through the same schooling that I have after me, and their school classmates were also half and half, doctors of chiropractic and veterinarians, and also did their certification through the IVCA. So all of this bill was written to protect animal chiropractic. It actually hurts animal chiropractic because you're eliminating a large portion of people who are certified through the only other certifying body, the IVCA. So we wouldn't be able to offer this modality. I went to chiropractor school for animals. I also went to acupuncture school for animals because I do believe there is a place in veterinary medicine for these extra modalities or alternative modalities. But as a veterinarian, I'm able to evaluate the animal first and determine what's the best way to proceed. For example, I saw a horse recently. A new horse owner, new horse, and her complaint was the horse was stiff in the hind end. I have a lot of sports medicine experience being a racetrack veterinarian and working on performance jumping and dressage and eventing horses. So after doing a lameness exam, I was able to pinpoint where the problem was. I took x-rays and showed the owner that the horse's hocks are fusing and that's the source of the pain. Chiropractic isn't going to fix that, but what it can do is help the horse because it is back sore. When you do have a problem in your knees, stifles, hocks, ankles, whatever, you're going to develop pain in other areas of your body. So that's all the owner was seeing. I was able to determine the source of the pain and determine the best route of therapy. So again, the way this bill is written, it actually hurts veterinarians and doctors of chiropractic who are licensed and have done the appropriate certifying and education in animal chiropractic. Thank you.
thank you. And next on our list.
I'm not sure I'll turn this on.
Oh,
Oh, they'll do
But-
that? Oh, good. Hey, I'm Dr. Richard Cole. I'm from Shelby County, Tennessee. And thank you, Chairman Terry, for allowing me to discuss this. And thank you for the members of the committee for allowing me to have this comments today. I'm the Vice President of the Tennessee Chiropractic Association, and I speak for that organization today. I speak in favor of House Bill 164, which develops a framework for chiropractic physicians to provide compassionate chiropractic healthcare services to animals. I had the pleasure to serve our state on the Board of Examiners under Governors Sundquist and Haslam. While on the examining board, I worked with the Federation of Chiropractic Licensing Boards, which was an oversight board over all licensing agencies in the United States, Canada, and Mexico. While I was on that task force, I chaired a committee studying the regulatory framework appropriate for chiropractic physicians to work with animals. We determined that chiropractic physicians board certified by the American Veterinary Chiropractic Association, which is the AVCA, were competent to provide quality chiropractic healthcare services to animals. The Federation published a model code for use by our members in developing statutory language for chiropractic physicians wishing to provide chiropractic services to animals. House Bill 164 contains the key elements in the Federation model code governing animal chiropractic services. Those include requirements for advanced postgraduate training, psychometrically solid testing, and continued professional development. Further, the bill codifies a long-held understanding that chiropractic physicians are the only physicians that can provide chiropractic healthcare services. Current state rules clearly articulate that only chiropractic physicians can provide chiropractic care, and this bill reinforces that understanding by statute. Chiropractic medicine is a distinct healthcare profession that views patients through a holistic lens We see the body as more than a sum of its parts. Only chiropractic physicians can provide chiropractic healthcare services because our special training in holism governed by a wellness philosophy. This bill also protects the practice of veterinary medicine, ensuring that chiropractic physicians will not be dispensing medicine or practicing surgery on animals. This bill simply allows chiropractic physicians to provide chiropractic services to animals. House Bill 164 is also in the best interest of the public. Currently, there are no advanced standards for veterinarians to provide chiropractic healthcare services that are required by statute. This bill provides a certification process for veterinarians to become licensed to provide chiropractic services to animals. With this bill, Tennesseans can be assured that when their animal needs chiropractic services, their properly trained veterinarian or a licensed chiropractor is adequately trained to do so. Thank you for allowing me to offer this testimony, and I'll be glad to answer any questions you may have.
Thank you. And that brings
Leaves
to next-
me.
Yes, thank you.
Hi, I'm Tiffany Stevens. I'm the Executive Director for the Tennessee Chiropractic Association, and I am also in support of this bill today. Many of you I've had an opportunity to speak to on this bill, so I'm not going to reiterate all of it, but I do want to hit on some high notes of the key elements of this bill because there has been a lot of confusion throughout the process. So what it does is it reinforces as much has been stated in testimony of the benefits that chiropractic services, non-surgical, non-pharmaceutical services offer to not only humans, but also to animals. And we are aware this is working well, not only in the state of Tennessee, but nationally as well. However, the ambiguous language in the state has caused some issues, and therefore why we are bringing this bill to you. What we've learned and what we are aware of is the AVCA training has a minimum core hours of 210 requirement hours in addition to the doctorate level training that veterinarians and chiropractors already go through. So it allows the veterinarians to be introduced into chiropractic and the services that are provided or able to be provided in joint manipulation and other procedures. Equally, it allows the core principles necessary to understand what veterinarians do and what they might see as a first access provider. That is something we already do on our people that come into our office on a day-to-day basis. So I think that is one of the things that have been stated, and I want to reiterate, we are trying to create clear lanes here, not muddy the lanes. So there will be many scenarios that come before a chiropractor that is providing animal chiropractic treatment that will have to pause and stop and refer to their veterinarian for further guidance or for further testing. Thank you. Collaborative care work is important to us. It's actually one of the core principles within the certification program. I am also aware of the IVCA training that has not been stated until today. So that's the first. I'm aware that there was someone in Tennessee that was represented. We did actually contact them, but that is not in the language. And AVCA training has been around since 1989 and is in multiple states across the country. Additionally, this bill makes clear lines for both boards, meaning the chiropractic board will regulate and oversee chiropractic providers because that's what they know and do. Equally, veterinarians will regulate and oversee veterinarians because the two don't cross. However, the two will cross on care to your animals. I think that has been a one consistent message throughout is we love our veterinarians, we love our chiropractors. And voting on your bill today is very difficult because it's people we care about. Our intent in this bill is not to change that relationship. As a matter of fact, this is a small group of people who have actually gone for this additional training. It's very costly, and it is something we want to support and make sure we reinforce those clear lines. Thank you. I hope you vote in support.
Thank you all for your testimony. And so we have a list of folks starting. I want to ask a few questions. So Representative Gillespie, you are recognized and you can direct it at any or all.
Thank you, Mr. Chairman. Thank you all so much for being here. I guess I'm going to start my question with the people that have testified that are testifying against. I've gone back and forth on this issue a lot. I've heard pretty much everything and everyone about it. And I'm still kind of going back and forth between this idea of if this bill passes and goes into practice, as an owner of an animal, I would still have the choice to decide whether or not I want to go see my vet or I want to go see an animal chiropractor. Is that correct?
Yes.
It is. Okay. So I guess my next question would be, do we not, and I know this is a kind of a loaded question, but do we not think that, or maybe I'm just approaching this from a dog owner and not a snake owner or an exotic pet owner, but do we not think that the general population can make that decision for themselves without creating an entirely new occupation?
You're recognized.
You would be shocked at the number of dogs that present to my practice on a weekly basis with suspected back or neck pain that do not have back or neck pain. It's referred from elsewhere within the body. The example I used in the Senate last week was of a Boston Terrier who came to see me that had an extremely painful thoracolumbar junction. So the part where the rib cage meets the low back, it's very painful. After a physical exam, some blood work, and a set of x-rays, I found the dog had a splenic tumor, a very large splenic tumor. But because the way the animal was tucked up in the abdomen with the suspected back pain, it's difficult to palpate that tumor. I could see it very clearly on x-ray. I ultrasounded it. So I've done blood work, x-rays, and ultrasound. That's 3 different diagnostic modalities, just so we're square. I found that it's a cavitated splenic tumor. So this dog has a tumor that has the potential to rupture and cause the dog death if it bleeds out. So I would love to say yes, that owners are very well qualified to tell whether or not their animal has an issue that's best directed at the veterinarian or the chiropractor. But unfortunately, in my 13 years of veterinary experience, that has not been the case.
You're recognized.
Thank you. Okay, so I guess that leads me to my next question. I'm not sure who this is directed toward, so I guess anyone that wants to answer. For the chiropractic side, if I brought my animal in with an injury like you just described, do we have the faith that the people that are doing that, the chiropractic side, are going to stop and check themselves and say, hey, this looks like it's a little bit above my scope of practice. I think you should go see a vet? Or again, am I coming across this the wrong way? Because and I don't mean to speak for the entire committee, but I think a lot of us are wondering the same thing.
Personally, I don't have the faith because going through the continuing educations to continue doing animal chiropractic, a lot of my CEs are written by DCs, and the way the language is written, they always write these CEs as if they're the first one to see the animal, and they're giving CEs on issues that should be seen by the veterinarian, like, for example, degenerative myelopathy. That's not even something that we can treat in veterinary medicine. It's definitely not something you can treat with chiropractic, but what we can do is help manage pain. And that's, again, one of the modalities that we use in veterinary medicine or as a chiropractor for animals, is to just help manage pain.
You're recognized. Oh, you're recognized.
Thank you, sir. Representative Gillespie, a couple of things to answer your question. One of the things that the reason why the Federation chose the AVCA as a certifying body was because we felt like the AVCA had a stronger diagnostic program, so it taught the chiropractors stronger diagnostic capacity than the IVCA did. So that was one of the findings that we found in our study. Secondly, chiropractors are trained to palpate the spine. If the dog that she talks about with the splenic tumor had come into the chiropractic office for an evaluation, the spinal dynamics of musculoskeletal problems would not be apparent, just like they aren't apparent on a human that comes in to see me with an internal pathology. It's quite evident for us to see whether this is a spine problem or this is another problem. Third thing, the AVCA standards require that all animals that we take care of are in good standing with their veterinarians. We can't see them without knowing that they have been seeing the veterinarian on a regular basis, getting their shots, seeing the farrier for their hooves to be trimmed, to make sure that these animals are getting the care that they're supposed to from the vets first, and then we augment by adding the musculoskeletal component to that. So those are 3 important aspects.
You're recognized.
One more question. that last point you just made. So what you're telling me is if this passes tomorrow, what you're saying is in order for me to take my animal to the chiropractic side of things, I also have to take a clean bill of health to them as well on paper, documented?
You recognize?
That,
If I could answer that question.
let me answer that question. The answer is we have to know that that animal has been to see their vet. Now, I guess we could say that they lied to us. We might not send them to the vet to get the paper. We just want to make sure, does this dog, this cat, does this horse, have they seen the vet? Are they in good standing? Tell me who the vet is. We'll make sure that there's this relationship before we take this on. And then we do the history, and then we do the exam, and we develop a differential diagnosis. And if that differential includes something that's of a deeper pathology, we're going to send the animal back to the vet for an evaluation.
You recognize?
But the way that it's currently written, you will be removing that veterinary oversight. So like what he said, there's supposed to be a collaborative effort between the veterinarian and the chiropractor. If this bill passes, then you're removing that veterinary oversight to make sure that the animal is in good health and can benefit from chiropractic. Also, to his point about IVCA versus AVCA, that's really just a matter of who you do your application through. When we were finished with my 5-week intensive program, they gave us the option. They put up a PowerPoint. They said, these are the benefits of if you join either organization. And then we all submitted our application to whoever we chose, which it was the IVCA. And then we submitted our testing fees. And then 2 weeks later, they came and they tested all of us. So each school meets the minimum standards for either certifying body. It's really just a matter of who you submit your application through to get certified testing through.
Thank you.
One thing that's important to note is that currently there are no standards. There's no requirement that any chiropractor or medical doctor be AVCA certified. So there are vets that are not AVCA certified or IVCA certified that are claiming to provide chiropractic healthcare services without any additional training. And there are chiropractors out there without certification, they have maybe some training, maybe some, but they're not certified, that are performing chiropractic healthcare services. What we're saying is we want to raise the bar. We want a certification for everybody, a higher level standing that we know that protects the integrity of the animal and protects the integrity of the veterinary practice as well.
All right. Thank you. Chairman White, you recognized.
Thank you. Yeah, how you doing, Dr. Cole?
Good to see you,
Good to
sir.
see you. What I'm having trouble getting past is the fact that if the diagnosis has been pointed out, if the symptom is something deeper than what we might think, and then it may be too late. That happens in humans also, as we know. So that's what I'm having trouble getting past. But my another thought kind of on the sidebar, if a chiropractic office sets this up, say this bill passes and you're seeing animals, do you have to set up a separate facility from the humans? I mean, you would have I would come in at one time and then you've had a dog in there before. Is that a separate facility? Is that in part of the bill?
You recognize.
Yes, so physician offices are regulated much like every office. They have OSHA regulations and other requirements, where veterinarians may have further regulations because they deal with bodily fluids, they do surgical procedures. That is not something that chiropractic offices do as a choice. When it comes to regulating the animals, part of this bill is that there has to be criteria set in place for additional practices. There's actually core practices, as Dr. Rick mentioned, as to what would be done differently, different rooms, different procedures, and how that is done. Obviously, for large animals, that may be more of an on-site location or something different.
Thank you.
All right. Thank you. Chairman Kumar, you recognize.
Thank you, Mr. Chairman. As you can see, it's really difficult for most of us to make a decision on this. And what I was told is that this care, chiropractic care for these animals, can be provided by a human chiropractor who has additional training in animal chiropractic care. That's 240 hours or something like that. Is that true?
Yes, that's what the bill would be asking.
Also, so these are human chiropractors who can provide this care. Then we will also have veterinarians who can also take the course for providing chiropractic care in addition to regular veterinary care. And the third question I have been asked is, can there not be a collaborative model?
I think that's
And why not? Because that may benefit the public and make our decisions easier.
You're
if I may. I think that's where we feel like this is the collaborative model. As you know, veterinarians through the years have talked about the benefits of chiropractic care. So there, as Dr. Rick stated, there have been chiropractors, because we know what we know, working with veterinarians. The difficulty is that no permissive language has made that clear. They have had the opportunity to do that. They have not done that. They have also further reprimanded or sent letters stating that this care needs to be stopped. That's the difficulty, because these are even people with this additional training. So what this really does is it focuses those who are doing the extra. While we certainly can say that can continue and collaborative care is an option, not doing something has become a problem for those who have done this extra certification, extra time, thousands of dollars in this additional training. It's equally been created for both professions as a collaborative effort to show this is where we're respecting each lane of both professions. So we feel very clearly that that's what this bill does.
You're recognized.
Final question. Under the current circumstance, before getting a chiropractor for the animal, does the owner need to have veterinarian clearance?
No, I mean, that's where it's difficult, right? There is a right to your owner and your property and what you want to have happen. So while if they're working with a vet or talking with a vet, that has been something that has been permissive until it's not. And that's why we are here today, because it's not been made clear and we want to make sure it is made clear.
May I?
Thank you. Again, the main remark that comes through is, can't you guys get along? Thank you, Mr. Chairman.
You're recognized.
So I would like to speak on the collaborative effort part. I would like there to be some sort of collaboration, but the way this bill is written, there isn't any collaboration, because again, you're hurting doctors of veterinary medicine as well as doctors of chiropractic who have done the schooling necessary to provide this service and the certification, just with a different organization. If there truly was a collaborative effort, we need to work together and include both certifying organizations, as well as also, I'm also trained in acupuncture. The acupuncture board isn't trying to regulate me doing this in veterinary medicine. So I don't necessarily agree with why the chiropractic board should be regulating me doing this in veterinary medicine. Anything that I do to an animal is considered veterinary medicine because I am a veterinarian first. So why is chiropractic being carved out of veterinary medicine, or just an alternative modality in general? And now you're saying I have to answer to both the veterinary board and the chiropractic board.
Okay. Thank you. Chairlady Carringer, you're recognized.
Thank you, Chairman. And I'm not sure if really I've got a question per se in it or just a statement, but I've heard a little bit about this bill because I was presenting a bill where it was last week, so I was in the audience. But I asked myself, why would a chiropractor, want to treat an animal that is not being regularly seen by their veterinarian doctor? And I think you could probably tell by the condition of the animals. Why would y'all want to put yourselves at risk in treating or missing something? So I go back from my family being in medicine as humans, and I'm a very much animal lover of all, but in terms of us, you can make an appointment and go see a chiropractor anytime you want. You don't have to have your primary care doctor or whatever physician you may be seeing, specialist or whatever, give you the okay to go see a chiropractor. So I asked myself, is there a big difference here? Our animals and our loved ones. So I don't know if I'm asking you a question or if I'm just really pointing out something that I see as we don't get an okay from a doctor to go to a chiropractor. So it's your animal, whether it be cow, horse, or, whatever animals. I love them. And I'm unfortunately, I don't own any large animals like that. I would love to, but I don't. But I would think that is the property, the one who owns those animals. And it is your right to be able to have your animal treated in the way that you think is next. And I would hope that a chiropractor of humans and animals, whatever, would maybe say, oh, I think there's a bigger issue here. And so I don't know if I'm really asking anybody or just really needed to make a statement. And I see someone's got a statement out there, but.
All right, thank you. I don't think I heard a question, so we will go with Representative Capley. You are recognized.
Thank you, Chairman. The good doctor over there on the right with the sharp orange tie answered my question, so I'm going to yield back. Thank you.
All right, thank you. Chairman Martin, you recognize.
Thank you, Chairman. As the sitting chiropractor up here, I guess I get to chime in, right? That's good. I appreciate all you guys coming, honestly. This has been great conversation and dialogue. I, for the record, don't do this, so it's not my specialty either, and I've talked to them about it, but there are great ones on both sides of the aisle doing this. So my concern or question, I guess, to the vets, you guys know, is chiropractic therapy or treatment taught as a core curriculum in your schools currently, or is this additional training that you have to get afterwards?
You're recognized.
It's additional training afterward. It's not considered a core competency or a core specialty when you're going through veterinary school.
But in my school, we did have electives. And so one of those electives through our AEP, American Association of Equine Practitioners, we did have practitioners who were either veterinarians or DCs come in and do wet labs with us on spinal manipulation, which that term specifically is from the Chi Institute down in Florida. They don't consider themselves chiropractors. They consider themselves spinal manipulation, which I guess in this bill, would they be considered to practice spinal manipulation, which AKA it's chiropractic, but they don't want to use that term chiropractic. They specifically want to use spinal manipulation. So although it's not included in our core curriculum during those 4 years, we do have the opportunity to have an introductory course in it.
I went to the University of Tennessee. Steve Adair, who's a veterinarian there, is also AVCA certified. He's not listed on the website. So in your count last week, he was excluded. But he is a very large proponent, has been since the 90s. I can remember being a 4-H or being 4th or 5th grade, going to UT and listening to Steve Adair talk about chiropractic. And so that was definitely included in our large animal surgery electives. We were very much exposed to sports medicine and chiropractic as well, although it was not considered a core competency and it's not on the national board exam.
You recognize.
One more. And then I guess for anybody out there. So on currently across the country, any other states that have this set up similar to what we're trying to do, where it's regulated by a certain board?
Okay, you recognize.
Yes, I think that is, I would like to address that also. In chiropractic school, there's also obstetrics that is taught, but our doctors are not delivering babies. So I think we get introductions into a lot of different areas of education. And state laws are permissive in a lot of states across the country. And there are many states, much like what we've done, where states are chiropractic is regulating those other their own profession. Chiropractors are regulating chiropractors, veterinarians are regulating veterinarians. And I think it's also important to know that chiropractic is a discipline. It's not one individual treatment. So in order to do chiropractic in Tennessee, you have to be a chiropractor, meaning you have to meet the criteria of being a chiropractor. So again, I think that we recognize the crossover, we recognize the importance of that, and this additional training respects both disciplines, or that is their intent.
All right. Thank you. You good? All right.
There are 3 states that currently have legislation that mimics the legislation we're talking about in this amendment. It's not a great number of states, it's 3.
All right. Thank you. All right. Seeing no other members with questions before us, thank you all for coming to testify. So
Thank
without
you.
objection, we will go back into session. Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. As you can tell, we love our vets and we love our chiropractors. And what we're saying today is we would like to be able to have a choice whether we go to the vet or the chiropractor with our animal. And I think that we've seen that if you take your dog or your horse to a chiropractor and they see that there's something beyond their scope, that they will and should promote their animal on to their veterinarian. So I'm hoping if this passes that our vets and our chiropractors will get along and make all of our animals more well.
All right.
I'll take questions.
All right. Any questions for the sponsor of the bill? Chairman White, you're recognized.
Thank you, Chairman. Can I address my question to our sitting chiropractor, Representative Martin? This is a tough one for me. Is that permissive?
Direct it to the speaker.
To the speaker, okay, and then maybe he can respond. Yeah. My question is this: as a chiropractor, sitting chiropractor, if a bill like this passes, and you, I guess, do the 210 hours, is that correct?
Yes.
And then you engage in this, and I bring my animal to you, dog, whatever it may be, because I say, well, it's limping around the house. How would you address that with this bill passed if you engaged in this?
Speaker, you're recognized.
I would address it that it would be your choice. If you felt like you should take it to a vet, then you take it to a vet. If you wanted to take it to a chiropractor, you could. And if the chiropractor was professional and he thought it was past his scope of practice, he would tell you to take it to a vet. The way I would see that working.
Thank you.
It's your choice.
All right. Chairman Martin, your name was called. Do you have any comments?
I would just chime in. I think from the standpoint, from a diagnostic component, I'd look at it the same way I would any other patient. So in a training setting, 210 hours or whatnot, additional training in that area, it's up to the provider. I take the responsibility of doing what's right for that individual person, that patient or animal in this case. So I'm going to go through that same workup, and it's on me, my responsibility as the provider, as the doctor, to make the decision if I can treat that or if I refer that. Same way I would if my colleague came to me as the provider. It's my responsibility to make the right decision in that moment for that patient. So I still think it falls back on the responsibility of the doctor, and that doctor would be, as was mentioned, the standard of care elevates everybody, not just the chiropractors, but vet can be included. Everybody's on the higher standard now. And I think that would be the response I would go with is the same way I would any other patient. You're going to treat them as you would in front of you and make the right medical decision for that individual or that animal.
All right. Thank you. Representative Capley, you're recognized.
Thank you, Mr. Chairman. Mr. Speaker, obviously I'm in support of this. I just wanted to make a few brief comments. As far as I'm concerned, chiropractors don't have to collaborate on humans, even newborns, and also vets are going to stay under the vet board and chiropractors are going to stay under the chiropractor board. So I think all we're doing here is we want owners of animals to have the choice where to take their pets. And we're going to let these people that have been doing this practice since the 80s continue doing what they've been trained to do. So in support, thank you for carrying it. And thank you for the time, Chairman. Thanks.
All right. Thank you. Okay. All right. Seeing no further questions for the sponsor, we are ready to vote. Madam Clerk, will you please open the vote? All those in favor of House Bill 164 moving on to government operations vote aye. All those opposed vote no. Has every member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 15 ayes, 6 nays, and 2 present not voting.
House Bill 164 as amended passes and moves on to government operations.
Thank you, Mr. Chairman, committee.
Thank you. That brings us to item number 2. House Bill 1141 by Chairman Boyd. You are recognized. You have a motion and a second, and there is an amendment that rewrites the bill. Drafting code 6415, is that correct?
Yes, Mr. Chairman.
All right. If there is no objection, we need a motion and a second on that. If there's no objection, let's go ahead and get the bill in proper form. All those in favor say aye. Opposed? Ayes have it. We're back on the bills amended. You're recognized.
Thank you, Mr. Chairman. Committee members, House Bill 1141 deals with the Health Facilities Commission as it affects the nursing home recertification. So it sets January 1st, 2027 as a deadline for the Health Facilities Commission to ensure that recertification occurs no more than 15 months apart. In the past, they've had some struggles and weren't able to meet that. And we've talked to the Health Facilities Commission, and they think they can do that and make it work within the 15 months apart. The big thing that it does, though, is it instructs the Health Facilities Commission to apply to CMS for a block grant waiver. This would actually be the first state in the nation to do something like that. It would include some reporting requirements on the progress of the block grant waiver, and it would name 3 assisted living industry groups that can provide the governor with a list of qualified candidates to fill the assisted living position on the commission. And Mr. Chairman, I have some folks here that can testify. If you want to go out of session and hear from them, I have Logan Grant from the Health Facilities Commission, and I do have some folks from the Tennessee Healthcare Association, or you can just take my word for it.
Okay. Do we have any members that would like to go out of session? I see none. Do we have any questions for the sponsor of the bill? Seeing none, I think, oh, there we go.
Thank you, Mr.
Chairman Clemens, you're
Chairman. Does this
recognized.
put the Health Facilities Commission back under the Department of Health?
You're recognized.
No, Mr. Chairman, it does not.
Thank you.
All right, thank you. Any further questions for the sponsor of the bill? All right, seeing none, we are ready to vote. Clerk, will you please open the vote? All those in favor of House Bill 1141 as amended, going on to calendar and rules, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, will you please take the vote?
Mr. Chairman, 21 ayes, 2 nays.
House Bill 1141 passes and moves on to calendar and rules.
Thank you, Mr. Chairman of Committee.
Thank you. That brings us to item number 3, House Bill 1349. You have a motion and a second. And I believe we have an amendment that rewrites the bill. Drafting code 6069, is that correct?
That's correct.
Okay, you have a motion and a second. If there is no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed, ayes have it. We're back on the bills amended. You're recognized.
Thank you, Mr. Chairman. House Bill 1349, as amended, requires a county medical examiner's office or regional forensic center, when conducting an autopsy on a decedent who is suspected to have committed a mass shooting that resulted in the deaths of 4 or more individuals, to consult each decedent's treating mental health professionals or primary care physicians, if known, to obtain information regarding the decedent's psychotropic drug use. Requires the county medical examiner to test the decedents for the presence of any drugs, including psychotropic drugs. Requires the county medical examiner's office or regional forensic center to disclose the use of the drugs to the University of Tennessee's Health Science Center College of Pharmacy and the Department of Health, and establish that the county medical examiner shall send only a blood sample of the decedent to the HSC, and requires to study the drug interactions between the psychotropic drugs and any other drugs that were present in the decedent's system, and requires the HSC to submit quarterly reports of the data obtained pursuant to the legislation of the chief clerks of the Senate and of the House of Representatives. And there is no mandatory reporting if there is nothing to report.
Okay, thank you for that explanation. So Representative McKenzie, you are recognized.
Thank you, Mr. Chair. And so, you know, as we're this seems like an investigative bill, and appears that maybe there's evidence. So is there any evidence that these types of drug use has led to mass shootings?
You recognize.
Thank you, Mr. Chairman. That is what this study would be for.
You recognize.
Thank you, Mr. You know, we actually looked into it, and according to the National Institutes of Health, they've already done a study nationwide, and I'm assuming just national. I'm sure it's national. And they hadn't found any connection. So are you feeling that something's unique about Tennessee or the mass shootings that's occurred here in our state that's going to give a result different from the ones that the NIH has conducted?
You recognize.
Thank you, Mr. Chairman. We're just wanting to see if any of the other drugs that are present other than the psychotropic, if they have any kind of interaction or what the interaction of the psychotropic drugs have done inside the body. I had a prescription the other day and it had so many side effects that I decided that I chose not to take those drugs because I wasn't sure what it would do to my mind or my body.
It's just fine.
You recognize.
Yeah. So that, that kind of gets to my concern is that people have concerns, but this data going forward doesn't look backwards. It may have been scary to you, but there were FDA studies. There were, they had field tests. There were all sorts of research done before that drug comes to market. And that's why you hear the long list of potential side effects. Those were realized by people, but that did a backwards looking, prior to implementing. What this one does, it doesn't cover the Covenant shooting. It doesn't cover any of these other shootings that we've had in the past. This is just looking forward. So I don't know what results can be gleaned from this when we already are doing studies and have done studies. And I'm sure if we ask the NIH, they could give us a breakdown of what's happened in Tennessee as a subset of all 50 states plus the territories in DC. So thank you.
Thank you. Any comments? Representative Mitchell, you recognize.
Thank you, Mr. Chair. Will this require them to keep a catalog of what type of assault rifle was used in the mass shooting?
You recognize.
That would be a bill for you to carry.
Let's stay on the bill. You're recognized, Representative Mitchell.
I just thought, to go along with the drugs, you need evidence based. You don't want to have that type of information in the study as well? Wouldn't that be pertinent?
I don't choose to do that today.
Oh, so half a study. All right, thanks.
All right. Any further questions for this? Question has been called. We are ready to vote. Will clerk please open the vote? All those in favor of House Bill 1349, moving on to calendar and rules as amended, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? The clerk, please take the vote.
Mr. Chairman, 17 ayes, 5 nays.
Thank you, Madam Clerk. House Bill 1349 as amended. Out of order. House Bill 1349 as amended passes and moves on to calendar and rules. All right. That brings us to the next bill, and maybe we have some people that might want to help you out on this one. House Bill 1351. We have a motion and a second. So you are recognized. And we have an amendment drafting code. Are we using 6776?
That's
Is that correct? Okay.
Mhm.
Can I get a motion? And a second? You have that. So if there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We are on the bill as amended. You are recognized.
Thank you, Mr. Chairman. House Bill 1351, as amended, requires a nationally recognized recovery resident standard organization certifying certain recovery residents in the state to adopt certain minimum standards as a part of the certification. Requires the Commissioner of Mental Health and Substance Abuse Services to select and approve organizations meeting the established minimal standards. Establishes that a recovery residence that is certified by the organization prior to January 1st, 2026 is not required to comply immediately with the medium standards established by the legislation, but instead remains subject to the certification standards in effect prior to January 1st, 2026 until the earlier date of the certification renewal. If such renewals occur on or after July the 1st of 2026 or January the 1st, 2027, establish that a certification of recovery residence is valid for no more than 3 years and requires a recovery residence to undergo a physical site inspection by certifying organizations at least annually for the recovery resident certification to remain in good standing. So I've worked hard on this bill for, I'd say, months. I probably spent more hours on this one bill than I have my whole 13 years I've been here with the bills. But I've worked, Chairman, you've helped me a lot too. And I've worked with mental health, and we've been all around. So we think this is the best bill that we could come up with for our sober living houses. And I've talked to many of you, and it seems like every county is having some kind of issue with these. So this bill is here to make everyone be good neighbors, and we are in compliance with ADA with this bill.
Thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, question has been called. So we are ready to vote. Clerk, can you please open the vote? All those in favor of House Bill 1351, moving on to state and local committee, vote yes. All opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, can you please take the vote?
Mr. Chairman, 21 ayes, 0 nays.
All right. House Bill 1351 passes and moves on to state and local.
Thank you, Mr. Chairman and committee.
Thank you. That brings us to item number 5, House Bill 960 by Representative Love. You have a motion and a second. And let's see here. Yes. Let me find my notes here. I believe there's an amendment. Is that correct?
Yes, sir, Mr.
Okay.
Chairman.
All right. The amendment number, let me see if I can get all my notes here.
Amendment is,
4786?
yes, sir.
Okay, I need a motion. Okay, you have a motion, and a second. Okay, if there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed, ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman and committee members. House Bill 960 seeks to provide opportunities for continuing medical education in the area of maternal mental health. And that is simply what this bill does, Mr. Chairman.
All right, thank you. Do we have any questions for the sponsor of the bill? Okay, seeing none, we are ready to vote. Clerk, will you please open the vote? All those in favor of House Bill 960, moving on to counter rules, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, can you please take the vote?
Mr. Chairman, 21 ayes, 0 nays.
Okay. House Bill 960 passes and moves on to counter rules.
Thank you, Mr. Chairman and committee members.
All right, thank you. Okay, we have disposed of item 6. That brings us to item number 7. So let me. House Bill 1205. You have a motion and second, Chairman Kumar. And which amendment are we going with?
We're going with 6582, Mr. Chairman.
6582. I need a motion. Motion. You have a motion and a second. Okay, this rewrites the bill, so if there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. We're on the bill as amended. You're recognized.
Thank you, Mr. Chairman. Members, treatment or prescription of medicine by a physician or podiatrist to themselves or to the family is not legally prohibited. Caution is needed because it is difficult for a prescriber to have a proper physician-patient relationship.
You may continue.
A physician-patient relationship with oneself or family. Professional organizations such as the AMA and TMA have issued ethical guidelines to help prescribers function in a safe and professional manner. There is, however, confusion among medical professionals, pharmacies, and media about the ability of prescribers to treat themselves and family. This bill uses the ethical guidelines from the TMA and AMA to confirm the conditions in which prescriptions to self and family is allowed. In short, a prescriber may prescribe medication to oneself or to family for short-term, self-limited, minor, or acute emergency conditions. A prescriber may also treat immediate family or themselves within the regular scope of their practice if there is no other provider, physician available within a 30-mile radius of the family's residence. This is to prevent the situation that in a small county, one physician is treating everybody's blood pressure but cannot treat mom's. A prescriber may also prescribe controlled substances to oneself or family only in acute emergency situations. With that, Mr. Chairman, I stand ready for questions.
All right. Thank you. Representative McKenzie, you're recognized.
Thank you, Mr. Chair. And I definitely understand the genesis of and the emotion behind this bill in terms of having the only family practice in a fairly large geographic area. And you described the good side of it, but isn't there another side that might end up biting folks in a bad way in terms of this same doctor could give overprescribe opioids to his, cousin, second cousin, great aunt, and there'd be a situation there that really could go undetected with it being in a rural environment. Aren't you concerned about that?
You recognize.
Thank you, Representative McKenzie. Well, that prescriber, if he makes that mistake for his own family, he's, likely to do that to other patients also, and will come under existing laws and reviews to be discovered, reported, and disciplined.
You recognize.
Thank you. And we had, I would say, a similar situation where they were in cahoots, right? You can share that bottle. The doctor was, this is in the eastern part of the country, of the state. And the relative was addicted. So they could share in that. It happens, and it happens. We talk about it, then things go awry. And this one, that aspect concerns me. I fully understand why you're bringing it forward, but there might just be some unintended consequences. Thank you.
All right. Chairman Kumar, you good? Okay.
Thank you.
All right. Any further questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. Madam Clerk, can you please open the vote? All those in favor of House Bill 1205 as amended, vote aye. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? All right, Madam Clerk, can you please take the vote?
Mr. Chairman, 15 ayes, 5 nays.
All right. House Bill 1205 as amended passes and moves on to calendar and rules. All right. That brings us to item number 8, House Bill 1203. You have a motion and a second. And let's see here. We do have an amendment that rewrites the bill. Is that correct?
Yes, Mr. Chairman, and that is
5152?
5152.
All
Thank
right, you have a motion and a second. All right, if there's no objection, let's go ahead and put that on the bill. All those in favor say aye. Opposed, ayes have it. We're on the bill as amended. You're recognized.
Thank you, Mr. Chairman. Members, ours is, as we know, a high-stress society, and medicine is a high-stress profession. Substance abuse or burnout and other mental health situations happen, not commonly, but close to rarely, but they do happen. The House Bill 1203 deals with a physician who's prone to or has indulged in substance abuse, who is self-reporting the situation before any harm has occurred. This is a good guy who realizes that he has a problem and he reports himself to the board. Hospital 1203 allows that the Board of Medical Examiners may issue a private advocacy order requiring monitoring of that physician by a peer assist organization to practice medicine in a competent, safe, and ethical manner under proper monitoring. Failure to maintain that relationship with that organization and follow the rules that are needed would lead to disciplinary action.
Thank
I
you for-
renew my motion.
All right, thank you for that explanation. Representative Mitchell? Question has been called. Madam Clerk, we're ready to vote. Can you please open the vote? All those in favor of House Bill 1203, moving on to calendar and rules, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Madam Clerk, please take the vote.
Mr. Chairman, 21 ayes, 0 nays.
Thank you. House Bill 1203 passes and moves on to calendar and rules. All right, that brings us to item number 9 on the agenda. All right, that is House Bill 466. So you have a motion and a second, and it is before us. And we do have an amendment, I believe.
Yes, we do, Mr. Chairman. 4009.
Okay, and you have a motion second, and all this does is works on the effective date.
Changes the effective
Okay,
date.
so if there's no objections, go ahead and get that on the bill. All those in favor say aye.
Aye.
Opposed, ayes have it. We're back on the bills amended. You're recognized.
Thank you, Mr. Chairman. This bill removes the mandatory 30 hours per week requirement for a lab supervisor to be on the premises in the code. Instead, the statute would clarify that a supervisor be readily available for consultations during all hours when tests are performed. Tennessee statute would remain in line with the federal CLIA guidelines that many other states follow. Current technology and the ability to provide remote monitoring make the requirement overly burdensome on a system that needs capacity. This bill would increase capacity without compromising safety and quality. And with that, Mr. Chairman, I stand for questions.
All right. Now, a question has been called. We are ready to vote. Will the clerk, Madam Clerk, please open the vote. All those in favor of House Bill 466, moving on to calendar and rules, vote yes. All the opposed, vote no. Has every member voted? Does any member wish to change their vote? Madam Clerk, can you please take the vote?
Mr. Chairman, 22 ayes, 0 nays.
All right, House Bill
Thank you, Mr. Chairman.
466 passes and moves on to calendar and rules. All right, thank you. That brings us on to item number 10, House Bill 1239. Chair Lady Haynes, you are recognized.
Thank you, Mr. Chairman. I do have an amendment.
Amendment rewrites the bill, drafting code 6128, is that correct?
No,
not?
sir. It is 5872. It's a clarifying amendment.
We combined them. It's the amendments we adopted.
Oh, we combined them into one amendment.
Okay. So is it 6128 now? Okay.
Yes,
thank you.
6128,
Sorry.
yes.
My mistake.
Okay, all right, phew, goodness, okay, so get a motion? A second, okay, so it rewrites the bill. If there's no objection, let's go ahead and get the bill in proper form. All those in favor say aye.
Aye.
Opposed, ayes have it. We're back on the bills amended.
Thank you, Mr. Chairman. House Bill 1239 as amended creates an exception for mid-level providers, nurse practitioners, and physician assistants to be able to prescribe buprenorphine products for the treatment of opioid use disorder in correctional facilities. This legislation outlines certain restrictions and requirements for them to be able to do so. They must be employed by or contract with a state correctional facility or a county or municipal jail to provide healthcare services. They are only authorized to prescribe buprenorphine products to patients who are treated through the correctional facility that employs the provider. They must be supervised by or collaborate with a physician who reviews 100% of the charts of the patients being prescribed a buprenorphine product and who is limited to the supervision of or collaboration for a maximum of 5 licensed nurse practitioners or physician assistants. They must have adopted clinical protocols for the facilitation or continuance of medication-assisted treatment for persons who are incarcerated in or to be released from such state correctional facility or county or municipal jail. They cannot have had any limitations or conditions imposed on the provider's license by the provider's licensing authority within the previous 3 years. They're prohibited from writing any prescription for a buprenorphine product that exceeds a 16 milligram daily equivalent, and they must have an active registration with the federal DEA. The amendment was just requested by the Department of Health, and it removes the provision that requires the prescriber to enter into the Controlled Substance Monitoring Database. These prescribers likely don't have access to the CSMD, and the pharmacies are already entering the info into the CSMD. And with that, Mr. Chairman, I stand for questions.
Do we have any questions for the sponsor of the bill? Seeing none, we are ready to vote. Will the clerk please open the vote? All those in favor of House Bill 1239, moving on to calendar and rules, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Madam Clerk, can you please take the vote?
Mr. Chairman, 23 ayes, 0 nays.
Thank you. House Bill 1239 passes and moves on to calendar and rules.
Thank you, Mr. Chairman and committee.
All right, thank you. That brings us to item number 11. That is House Bill 869. Chair Rudder, you have a motion second, and I believe you have an amendment that rewrites the bill. Is that correct? 3828, is that correct?
Yes, that's correct.
Okay, you have a motion and a second. If there is no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended.
As amended, this bill makes changes to an electronic health record bill that we passed last year. And after we passed that bill, there were some issues with constituents and their lab results being held up and some concerns from insurers. This bill is going back to make some changes to fix those unintended consequences. Last year, we passed a law with the right intentions, but it inadvertently delayed lab results for patients across Tennessee. This bill fixes the issue by repealing the 72-hour hold on certain lab tests. We make sure that Tennesseans receive their lab results in a timely manner without unintended government delays. Tennessee is the only state that requires 72-hour hold on lab tests, and this has unintentionally created a bottleneck in lab results for diagnostic companies as they try to comply with this unique regulation. Last year's bill also requires that the insurance companies create and maintain an application programming interface, an API, to facilitate patient and provider access to health information. We required those APIs to be created by July of last year, which was not feasible. So this bill ensures that the requirement for creating those APIs to align with CMS dates of implementation. And I also would like to add that last year's sponsor was Chairman Vaughn, and he has signed off on this piece of legislation. And also in the Senate, Senator Reeves carried this legislation, and he has now passed it in the Senate. And with that, I stand ready for questions.
Right, thank you for that explanation. Do we have any questions for the sponsor of the bill? All right. Seeing none, we are ready to vote. Will the Madam Clerk please open the vote? All those in favor of House Bill 869 as amended, moving on to insurance, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Madam Clerk, please take the vote.
Mr. Chairman, 22 ayes, 0 nays.
Thank you. House Bill 869, as amended, moves on to insurance.
Thank you, Mr. Chairman and committee.
Thank you. And that brings us, item number 12, has been taken off notice. That brings us to item number 13. So it's House Bill 638. Chairlady Carringer, you have a motion and a second. And we're adopting both amendments, is that correct?
Yes.
Okay, amendment number 6091, is that correct? Or
Yeah,
what's?
Well,
oh, wait,
that's the
hold
one that was put on, that was put
Which
on
one do we
last
need to
week in
adopt
sub.
first?
Yeah.
These don't conflict?
Yeah.
Okay. So, so 6091, okay, I need a motion.
Motion.
Okay, and a second. Okay, if there's no objection, let's go ahead and put that on the bill. All those in favor say aye. Opposed, ayes have it. Okay, the other amendment, which does not conflict, is 6046, is that correct?
That's correct.
Okay, I need a motion. And a second. Okay, if there's no objection, let's go ahead and put that on the bill. All those in favor say aye. Opposed, ayes have it. All right. Okay, and if this passes, we will roll these into one amendment. You are recognized.
Thank you, Chairman and committee. So the newest amendment, 6046, rewrites the bill, and it removes the word solely that was included in the previous. And then, of course, the amendment that I added last week in sub, which was brought to me by the Nurses Association, was to put back an exemption to the bill for transplant services, oncology, and immune compromised patients. And then also the one we just had was the refusal to obtain immunization based on religious or moral beliefs. So that's what the amendments put in the bill.
All right, thank you. We have Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. Madam Chair, I'm concerned about this restriction making physicians less likely to be willing to accept TennCare and reducing accessibility for low-income patients to healthcare providers. Can you address that concern?
Okay, you're recognized.
Yes. Thank you, Representative, for your question. And we all know any people who are on TennCare, it is a state-funded insurance, and those are the ones that really do need to be, by their physician, encouraged to take immunizations. However, we already have, the moral and religious beliefs already for those who wish not to, because it is their choice. It's their body. But so this bill was brought to me by a constituent, and that have medical discrimination against their families who choose not to vaccinate. Again, it is your choice. So I will just say my husband is a hospitalist, and anyone who is a physician in hospitals do not get a choice. Cannot ask the patient, I'm not going to treat you because you may not have had your flu vaccine, or you might not have had your RSV vaccine. So, if you're taking TennCare patients, TennCare already has policy and rules that if a doctor agrees to see TennCare patients, this is just saying that they cannot deny medical treatment just because someone has refused to take a flu vaccine. So I hope that answers your question, Representative.
Thank you, Mr. Chairman. No, but so what kinds of liability issues might this raise for physicians? Does the bill include any release of the physician from liability for this decision?
You're recognized.
I don't follow what your liability is. If they agree to see TennCare patients and the patient is cancer patient or is immune compromised or is transplant or has a religious or moral exemptions, then, you know, I mean, if they're not going to see them because they have either of those, then that's up to the physician as to whether or not, I guess, they take TennCare patients and want to get reimbursed.
Chairman Clemens.
Thank you, Mr. Chairman.
No further. Okay. Any further questions for the sponsor of the bill? Chairman Kumar, you recognized?
Thank you, Chair Lady Carringer. You and I have talked about it, and it's been a struggle how to accept this in the sense that what if there is a measles outbreak in Knoxville next month? Under that scenario, what do I see happening in the sense that it will be dangerous to allow an unvaccinated child to come into a clinic? Kindly elaborate on that. You know what I'm talking about. What would happen under that scenario, and what would be the risk to patients?
You recognized.
And thank you, Representative Kumar. And we all come from the same medical background in the sense that vaccinations are important. But however, it is a choice. And you already have these children, and you're talking about strictly pediatrics, pretty much. So if a physician, I mean, I know many of the pediatricians in Knoxville see children who are immune compromised, but may not have all the vaccines that are, you know, recommended. So again, it's a choice as we all have. And so, you know, if a doctor's taking TennCare patients and a child is immune compromised, then I guess that exempts them from not seeing them if that's what they choose.
You recognize.
Thank you for clarifying that. So what you're saying is, if I'm a practicing physician and in my waiting room, there may be an immune compromised patient and another patient wants to come in, I can refuse to see them in order to protect those patients that are in my practice.
You recognize.
That's correct.
Thank you.
Thank you. Representative Gillespie, you recognize.
Thank you, Mr. Chair. Sponsor, basically that last question, half of it was what I was going to ask. I just want to follow up by my concern, if I'm hearing this correctly. Right now at the pediatrics that I went to when I was a little kid, and my nieces and nephew go there now, there's a well room and there's a sick room. If you're sick, you go to the sick room. If you're just there for a visit, you go to the well room. Right now, a lot of people that are, you know, not vaccinated or are hesitant to get vaccinated, I feel like this would add an awful amount of confusion for that. And then those providers would just pick one or the other, and therefore creating a vacuum for TennCare kids, at least in my area. Am I understanding this correctly, or can you elaborate or answer that concern I have?
You recognize.
Thank you, Representative. And being a mother and a grandmother, I have taken my kids and my grandchildren to a pediatric office, and my kid has been completely well and had all the vaccines and everything, but there are very sick children in there that come through the same check-in and the same check-out, and the only thing separating well and sick children is one wall, that we all had to walk by the sick room into the well room. They go in the same offices, and, you know, yeah, maybe they wipe some things down, but we know the germs are in the air. So again, this is saying, if you want to take TennCare patients, here's all these exemptions that any physician's office has right now. And I would say there's some in this very room that are probably not up to date with all their vaccinations. So what do we want to say vaccinations? Is it you didn't take a flu vaccine? You didn't take your up-to-date COVID vaccine? I mean, we're surrounded every day. And so just going to a pediatrician office does not save you from getting something that you may have come in that you didn't have. So this is not an intention to hurt anyone in the medical field. It's just simply to say, all physicians have to take what they don't have to take. They can decide on patients that they want to see with certain insurance companies, and certain insurance companies pay for certain things and they don't pay. So that is a choice. So, it's got every exemption in there that I feel like the medical world already has. And it's just saying simply to TennCare providers. And this is all that it affects. So there are rules and policies for all of that. So it's got all the exemption to allow a physician to not see a patient. But if you do take TennCare, you cannot refuse to see that patient just because they may not be vaccinated. But most of them are probably going to fall within all these exemptions and go a lot further than any other, family or internal medicine or any other doctor, So if you make an appointment with your surgeon, are they going to ask you, are you vaccinated before they see you? No. I've never had a physician ever ask me if I was vaccinated before they saw me. So this is just for TennCare providers. And I've listened to the Nurses Association and anybody else in the medical field that wanted to come to my office to discuss this. And those that have not, I still have included you in here in this bill. So with that, I'm happy to answer any more questions that anybody may have, but that's what this bill does. It does not do any more than what people are out there trying to say it does.
All right. Thank you. Representative Mitchell, you're right.
Yeah, thank you, Mr. Chairman. Yeah, TennCare in its inception required childhood vaccinations. That's why we were the number one state in the nation for many years in childhood vaccinations. But in 14 short years, we went from first in the nation to 48. And this will be just another step to get us to the bottom where we, I guess, as a state like to be in health rankings. So with that being said, I'm against this bill.
All right. Thank you. Shirley Carringer.
Thank you, Representative, for your statement. And TennCare requires childhood vaccinations, and this is just allowing those providers the exceptions to be able to see patients if they, with religious and moral values, they can already, TennCare, they see those patients. If they have a religious and moral rejection to vaccine, they can still see them and get paid. And this is just adding some other exemptions to that.
All right, thank you. Any further questions for the sponsor of the bill? All right, seeing none, we are ready to vote. Will the clerk please open the vote? All those in favor of House Bill 638 as amended, moving on to government operations, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Madam Clerk, will you please take the vote?
Mr. Chairman, 12 ayes, 8 noes, and 2 present not voting.
All right, thank you. House Bill 638 passes and moves on to government operations. Right, that brings us to item number 14, House Bill 865. Let me find my notes here. Okay.
Thank you, Mr.
Leader
Chairman.
Hicks,
I
you're
believe I
recognized.
have a amendment.
Okay. So you have a motion, a second on the bill, and amendment is
6908.
6908. You have a. Okay, it's 6908, and it rewrites the bill and allows promulgation rules. It was untimely filed, but if there's no objection, we will vote to put that on. All those in favor say, oh, you had a motion and a second? Motion and a second, okay. All those in favor say aye. Opposed, ayes have it. You are recognized.
Thank you, Mr. Chairman. This bill addresses the nursing shortage in Northeast Tennessee. Ballot Health received a grant that will help partner with local TCAT, community colleges, and our university to create a pipeline of nurses in our community for high school students who will have a desire and aptitude of providing care. The program is designed for students who meets all their high school graduation requirements by summer of their junior year and begin hands-on experience and training to be able to enter the workforce upon graduation. Thank you, Mr. Chairman. I'll be happy to answer any questions.
Right. Thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, we are ready to vote. Will the clerk please open the vote? All those in favor of House Bill 865 as amended, moving on to government operations, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? All right. Madam Clerk, please take the vote.
Mr. Chairman, 23 ayes, 0 nays.
All right. Thank you. House Bill 865 passes and moves on to government operations. All right, thank you. That brings us to item number 15, House Bill 979. Have a motion and a second, and we have an amendment that rewrites the bill 6940. Is that correct? Yeah, it's untimely filed.
Yes, sir, that is correct.
Okay, it is, motion second, it's an untimely filed amendment that rewrites the bill. If there is no objection, we'll go ahead and put that on the bill. Seeing none, all those in favor say aye. Aye. Opposed, ayes have it. We are back on the bill as amended. You're recognized.
Thank you, Chairman and members. For over 50 years, Tennessee law has prohibited anesthesiologists, emergency physicians, pathologists, and radiologists from seeking direct employment to hospitals. At the same time, hospitals have been allowed to employ other physician types, such as hospitalists. This long-standing restriction has created an imbalance and left our hospitals unable to fully address the patient's needs and the services, critical healthcare services that are needed to be provided for in our communities. I have long expressed the concern over this, and particularly have experienced it myself in the last several weeks as my wife was a patient in our own local hospital. As Tennessee's population continues to grow and age, the demands on our healthcare system are going to continue to grow across the state. Chairman and members, this bill, ironically, is in health today because of the healthcare business that it is currently going on, but it's actually a workforce development piece of legislation, particularly for those rural areas like mine across the state. This amendment, Drafting Code 6940, which rewrites the bill, is strongly supported by healthcare organizations, including the Tennessee Hospital Association, Tennessee Medical Association, Tennessee Society of Anesthesiologists, Tennessee Radiological Society, and the Tennessee American College of Emergency Room Physicians, and finally the Tennessee Academy of Anesthesiology Assistants, as well as many others. Broad support from these stakeholders highlights the widespread recognition of the need for reform and the positive impact this legislation will have for the healthcare landscape across Tennessee. This bill will allow hospitals and counties with a population of 105,000 persons based upon the 2020 census, as well as children's hospitals, to be allowed to employ those four types: anesthesiologists, radiologists, pathologists, and emergency room physicians. This change will provide hospitals in these underserved areas, like in Putnam County, with greater flexibility in staffing, helping them address the critical access shortages to improve healthcare delivery across our state. By allowing these facilities to employ specialists, we empower them to make the necessary adjustments to meet patients' needs. In addition to this, there were some additional changes that the chairman of Health Sub asked us to look at to make sure that we were protecting the current practice in our hospitals as it relates to the original language associated with CRNAs. I'm happy to say that after many phone conversations and discussions, I think we've gotten this bill in the best place that we can. First, the mandatory language also deletes and replaces the original medical direction language for hospital employed anesthesiologists and makes it clear that the model will in no way impact CRNAs or hospitals' ability to use whichever anesthesia care ratio model needed to best serve Tennessee's patients. Second, it makes a change to the definition of an anesthesiologist to make sure all Tennessee licensed anesthesiologists can supervise. Third, it makes a cleanup requested by the Department of Health. And particularly on page 3 of the document, page 10 of the document, section 6321-104, we did make some changes to make stakeholders happy as it relates to changing the word from may to shall. With that, Chairman, I'm happy to answer any questions the members may have. Thank you.
Thank you. Do we have any questions for the sponsor of the bill? All right, seeing none. Roseanne McKenzie.
Thank you, Mr. Chair. And to the sponsor, I appreciate you bringing the bill, and I really appreciate you having that number, because I think this is a rural bill, and it's going to do good things for that community. So, but there's no plans to expand this to, higher density counties in the future, are there?
You're recognized.
Thank you. No, there's no intent of the sponsor to change any of the population requirements that are currently in the statute.
Thank you. Representative Hammer.
Thank you, Mr. Chairman. Quick question for the sponsor. Would a CRNA still be able to practice under medical supervision, QZ billing?
You recognize?
Yes.
That's it. All right. Any further questions? All right. Seeing none, I've been asked by TANA and TSA to make a statement on the clarification that relates to medical direction language in the bill, and I'm happy to do so. And obviously, I have a conflict on this bill, so I'm going to be blue lighting it. But so to be clear, this bill does not say that a hospital-employed anesthesiologist has to only medically direct cases, nor does it say that that if a hospital employs an anesthesiologist, all cases will be medically directed. Nor does it say that if a hospital employs an anesthesiologist, that a CRNA has to be medically directed. It says that a hospital, to the extent applicable, will ensure the anesthesiologist is able to comply with Medicare conditions for payment for medically directed or personally performed anesthesia services if they are employed. And so the intent is that the hospitals will ensure that the patient volume or operating room conditions do not prohibit an anesthesiologist from performing perioperative care. And it just so happens that the perioperative care guidelines are outlined in the CMS medically directed language. So the TSA has asked that hospitals not put anesthesiologists in untenable position of being unable to perform perioperative care, and the THA has agreed to not place patients and anesthesiologists in that position. Not place anesthesiologists in that kind of position. Again, it does not say that every anesthetic is going to be medically directed, but the intent is that hospitals will ensure that the patient volume or operating room condition does not prohibit an anesthesiologist from performing perioperative care. Thank you. Clerk, can you please open the vote? All those in favor of House Bill 979 as amended, moving on to government operations, vote yes. All those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 21 ayes, 1 nay, and 1 present not voting.
Okay, thank you. House Bill 979 passes and moves on to government operations as amended. All right, that brings us to item number 16, which is my bill, and I will pass the gavel.
Thank you, Mr. Chairman. That does bring us to item number 16, House Bill 990, and I believe there's an amendment.
I need a motion.
Need a motion and a second on the bill. We have a motion and a second. And with that, Amendment 4937, is that
4937.
correct? Okay, without objection, we've got a motion and second. Let's go ahead and put the amendment on. All those in favor say aye. Opposed? The ayes have it. So Amendment 4937 goes on the bill, and Chairman Terry, you're recognized on the bill as amended.
Thank you, Chairman Committee. And this is a clarification bill for the Human Life Protection Act. Section F of the Human Life Protection Act supersedes other laws, supersedes our other laws, and thus our clarifying language in in the other sections of code may not apply. So when we passed the Human Life Protection Act, we did not specifically add the clarifying language from another part of code to this section of code to better define or clarify serious risk of substantial and irreversible impairment of major bodily function. And so that clarifying language was pre-Dobbs, but since we are now operating under a different set of circumstances, we can adjust that language to better reflect the circumstances. And so what this bill does is it does specify that that these certain conditions may cause serious risk of substantial and irreversible impairment of a major bodily function. And so that may include pre-viable, preterm premature rupture of membranes, inevitable abortion, severe preeclampsia, Muir syndrome associated with fetal hydrops, and an infection that can result in uterine rupture or loss of fertility. The current law does state that you have to provide the best opportunity for the baby to survive. So this doesn't say that if these conditions are present that you can definitely have an abortion, but we recognize that these conditions may lead to a substantial and irreversible impairment. I want to make it clear that these aren't new exceptions. I do think that our Human Life Protection Act does cover those conditions. However, we want to provide more clarity as we did previously, and reasonable medical judgment still applies.
Thank you. Are there any questions of the sponsor? Chairman Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. Mr. Sponsor, can you tell me how this language of this legislation interacts with the existing court proceedings on the state statute?
Chairman Terry, you're recognized.
Can you be more specific?
Yeah, my concerns with this legislation is that it's not an attempt to fix the legal issues with actual legislation in a manner that will better protect women and families in the state of Tennessee, or keep medical professionals out of the role of making legal decisions rather than medical decisions, but rather an attempt by the Attorney General to try to eke us through a lawsuit that the state's facing right now. Can you address those concerns?
Chairman Chair.
Yeah, thank you. So the clarification issue was brought to me, and then there was another bill that was dealing with potentially with fatal or lethal fetal anomalies. I don't think that bill was going to get through. My original bill that I brought, my original language that I brought off to get this off the clerk's desk did not have all these conditions in them. But I think that this bill, what it does is it brings the clarifications that we needed for preeclampsia, pre-viable, preterm rupture membranes, and inevitable abortions, which we have had forward, so that we can have that for the clarification for our patients. What we've had when you have I think the term that we've had previously when you talk about an exemption or anything along those lines, one of the issues that we've had is that, to me, that's a two-step process. Step one is that you have the diagnosis. Step two is you have to determine whether the severity and the circumstances imposed as substantial risk. And for me, what this does is help clarify step one of the diagnosis.
Thank you, Mr. Chairman. I appreciate you responding to that and speaking a little bit how this was brought to you. This body, a member of this committee, actually had good legislation that could have addressed this for the benefit of women and families, as well as our healthcare providers. I wish we had taken that piece of legislation up and moved it along, and I hope we will do so next year to actually provide some real solutions to this ongoing problem. Thank you, Mr. Chairman.
Thank you.
Thank you. Chairman Hill, you're recognized.
Thank you, Mr. Chairman. And just a quick question for the sponsor, Chairman, does this legislation, does it add more exemptions the existing code of legislation or law that had been passed over the last couple of years. And does it do that?
So great question. That's what I tried to ask or answer previously. I don't see this as an exemption. So an exemption is essentially if you have condition X, then you can have an abortion. This says that if you have this condition's a diagnosis, you may, and it depends on what the severity is, and step 2, which is the severity and circumstances, and whether or not it imposes a substantial risk to the woman. So, for example, severe preeclampsia, I'm going to give you an example. My wife, it's her birthday today, had severe preeclampsia with our son, and he was at 35 weeks delivered. So it was not, so severe preeclampsia would not be an exemption in that case. But in the event that you had a rare instance of severe preeclampsia pre-viability, the treatment for that usually is you can either give magnesium, treat blood pressure, but you may not be able to get the unborn to viability. In that case, the circumstances would meet that risk. And so, no, this does not provide a new exemption.
Chairman Hill, you're recognized.
Thank you, Chairman. And if the provider, without this legislation, if the provider needed to take steps and make decisions, is it not possible? Is it not possible with this legislation? In other words, is this needed? Is someone going without care, or is there what's the deficit that we see that makes this necessary?
Chairman Terry.
Thank you. I think the answer to that is for clarity. We're doing this for clarification. It's what we've had previously, and I think this provides clarity for the physicians. It's something that they've asked for. So I think that when I talk about the 2 steps, step 1 and step 2, if this can provide more clarity to make step 1 efficient, then I think it helps the patients.
Thank you, Chairman.
Any other questions? Chairman Kumar.
Thank you, Dr. Terry. Just to, in my mind, clarify, number 1, the situation with these conditions listed is that the baby is not viable. Is that a fair statement?
Please repeat that.
Okay. The conditions that are listed in the bill, under those conditions, is it a fair statement to say that the baby is not viable, the baby is not going to live?
Chairman Terry.
That would not be correct.
Okay. So the baby might.
They might or they may not.
Okay, might or might not. Then the decision to perform the procedure on the physician's behalf would be based on protecting the health and life of the mother?
Chairman Terry.
Correct. And then current statute also discusses providing the best opportunity for the baby to survive.
Okay. So baby might have a chance, an effort is made to give the baby the best chance to survive, but mother's health is in jeopardy. And this will make the decision-making process easier for the physicians without being threatened.
Correct.
Thank you.
Okay. Any other questions? Seeing none, without objection, we will be voting on House Bill 990. Clerk, please open the vote. All those in favor of House Bill 990, please vote yes. Those opposed, vote no. Has every member voted? Does any member wish to change their vote? Clerk, please take the vote.
Mr. Chairman, 15 ayes, 6 nays, 1 present not voting.
Okay, the ayes have it, and House Bill 990 as amended will be moving on to calendar and rules.
All right. I'd like to take a moment. We've finished our calendar, and it appears that we have finished our work for the year. So I'd like to thank the members of the committee. Appreciate the work that our committee has done. Thank you for your dedication and flexibility in creating fair legislation that betters the entirety of the state. I'd like to thank our committee staff, Mike Critchfield, Heather Asbell, and Jamie Shanks, and my legislative assistant, Megan Dix. Also like to thank our health committee intern, Maverick Emberton, and our clerks, Jennifer Andrade and Adam Bryant, and our sergeant at arms, and there they are, Donnie and Tony. It's been an honor to serve alongside the members, and without objection, we are adjourned to the call of the chair.
Mr. Chairman, you didn't let anyone brag on you.